Diabetes impacts many facets of your health. A common sign of the disease is seen in our sight. A leading cause of blindness is due to diabetes. However, a new facility in Edinburgh hopes to tackle that statistic. Channel 5's Carolina Cruz spoke to the ophthalmologist about the impact diabetes has on our eyes.
3 years ago, Maria Cantu started changing her habits, eating better and working out. The changes came after a life-altering diagnosis.
Más antes uno de muchas cosas no sabía, no se informaba, no le daban información a uno, como el colesterol y muchas cosas de eso. Uno no sabía muchas enfermedades, la diabetes tampoco.
Cantu was diagnosed with diabetes. She's learned to watch what she eats. Otherwise, it takes a toll on her health.
Se siente uno mal cuando se desmide uno.
Cantu also suffers from complications with her eyes due to diabetes. Dr. Jorge Antonio Montes is used to seeing patients like Cantu. He's the first ophthalmologist with Doctors Hospital at Renaissance Eye Institute. He works at a center that opened its doors earlier this year. Services focus on diagnosis and treatment of a range of eye illnesses.
Talking specifically about diabetes, I think it's really important. It tends to be one of the leading causes of blindness worldwide. And unfortunately, it doesn't have a lot of symptoms in the beginning. So if you don't catch it early on, which, there's no way to catch it early on other than looking in. So again, that kind of ties into the importance of the eye screening.
Dr. Montes explains diabetes impacts the entire body, especially the extremities, eyes included.
Those things that's the furthest away from the heart, where the brain and the eye and also the feet get the least circulation, so that gets the least oxygen. And that's why we see a lot of feet problems, but at the other end of the spectrum is the eyes, and so we tend to see a lot of low blood flow to the eyes.
Since symptoms of damage to the eye can go unnoticed, Dr. Montes emphasizes early screening. He says it does make a difference in tackling the disease.
It's nice to catch it before it becomes a big problem where scarring tends to take place and so forth. When scarring is involved, it's really difficult to reverse those type of changes. And you may not have a symptom of scarring until it's too late.
Cantu received treatment of her vision when she was first diagnosed with the illness, but still suffers from some minor complications. Diabetics should schedule eye screenings at least once a year. Stage level will ultimately dictate how frequent your visits should be. In McAllen, Carolina Cruz, Channel 5 News at 4.